Welcome to this deep dive, especially if you're listening while preparing for the UPSC exams. This one's quite relevant. Today we're drawing on reports from the Indian Express, and we're looking into something really significant in contemporary India. That's the growing emotional and psychological challenges young people are facing. Our goal here is really to pull out the key facts, the data points, that show just how big and urgent this youth mental health issue is. It's vital context for understanding India today.
It absolutely is. And the data, well, it paints a pretty sobering picture, doesn't it? Young people are navigating some complex pressures, and it has ripple effects across society.
It really does. Let's start with just the sheer scale. The NCRB data showed over 40,000 student suicides in the last 5 years alone. That averages out to more than 20 young people dying every single day. It's staggering.
It is. And even beyond those tragic numbers, remember the National Mental Health Survey back in 2016? It found 1 in 10 adolescents was already dealing with a mental health disorder. That's a huge number.
1 in 10. And think about India's population. We have, what, over 250 million people under the age of 20?
Exactly. And yet the investment just isn't there. The Indian Express highlighted this: less than 0.5% of the total health budget goes to mental health.
Less than 0.5%.
Yeah.
Yeah.
So there's this massive young population, clear evidence of need, and, well, a serious lack of resources allocated to help them.
And then, of course, COVID-19 happened. It seems like the pandemic just threw fuel on the fire, didn't it? Amplifying problems that were already there.
Absolutely. Lockdowns, the huge shift online, it really hit young people's emotional well-being hard. We saw this increased digital dependency, the lines blurred, between real connection and just being online.
Right. And that reliance on social media, seeking validation online instead of building self-esteem internally.
Precisely. Plus, constant exposure to these curated, often totally unrealistic lives online. It can really feed into anxiety, insecurity, especially around how you're performing academically or socially.
That whole online culture feels like such a pressure cooker. The constant comparing, the FOMO, fear of missing out, it just seems designed to create anxiety. The Indian Express mentioned that Netflix show, Adolescence, sort of reflecting the gaps in support young people face trying to navigate all this.
And another critical piece, also reported, is the cultural aspect, including some online influencers pushing, well, what gets called toxic masculinity.
Ah, right. Discouraging boys from showing emotion, seeking help.
Exactly. It reinforces these really harmful stereotypes about suppressing feelings. We urgently need to shift that narrative, redefine masculinity around empathy, emotional openness.
So given the scale, the COVID impact, the cultural pressures, what kind of systemic changes are needed? What did the report suggest?
Well, the education system is a key starting point. There's a real need to integrate mental health support right into schools.
Like having counselors readily available, mental health programs.
Yes, counselors, specific programs, but also teaching things like emotional education and digital literacy, helping kids navigate the online world safely and healthily. Emotional intelligence skills are vital too.
And obviously, that tiny budget percentage needs to change dramatically.
Without a doubt, a significant budget increase is essential. We need to expand services, especially reach into underserved areas, and tackle the shortage of trained mental health professionals. The reports make that very clear.
Beyond the big system changes, what about families, communities? Their role must be huge.
Crucial. Absolutely crucial. Destigmatizing mental health conversations has to start at home, in our communities. We need environments where young people feel safe talking about how they feel, where adults can recognize signs of distress and, actually respond supportively.
And maybe public figures opening up helps too, normalizing these struggles.
Yes, that can have a powerful impact. Seeing people they look up to be authentic about their own challenges helps break down stigma.
Ultimately, the message from the Indian Express reporting seems clear. Tackling youth mental health isn't just a health problem. It's fundamental to India's development.
That's exactly right. Ignoring it means huge potential losses, human potential, economic potential. It really demands urgent, empathetic action from government, from civil society, from all of us.
So for you listening, especially our UPSC aspirants, remember this. Understanding the emotional well-being of India's youth is key to grasping the nation's future trajectory. The insights we've discussed today, drawn from the Indian Express, point to a critical area needing thoughtful policy and, frankly, just more empathy. As you think about the future, consider what kind of support systems will you help build for this generation. We hope this deep dive was useful. Please do like and subscribe for more discussions relevant to your preparation. Leave any comments or questions below. And again, our thanks to the Indian Express for the reporting that informed today's conversation.